Transforming Health in Africa, a social change approach. Welcome everyone to this deep dive into how local authorities in Africa, those unsung heroes, those often overlooked but vitally important figures, can drive systemic change to improve public health. Because let's be honest, healthcare shouldn't be a luxury, it should be a right, accessible to all. Today we're going to explore the social change approach, and no, this isn't some fancy academic term designed to confuse you, it's actually quite simple. We're looking at how tackling social issues can have a ripple effect on health outcomes. Think of it like this: if you fix the leaky roof, the whole house benefits, right? Same principle applies here. We're talking about addressing things like poverty, education, even something as basic as access to clean water. It's about understanding that health isn't just about hospitals and doctors, it's intricately woven into the fabric of society. So buckle up, because we're about to embark on a journey that explores how local authorities can be the architects of a healthier Africa. Policy reforms laying the foundation. Now, let's talk policy, and no, don't click away just yet. I promise this is more interesting than it sounds. Local authorities, they're the ones on the ground. They see the challenges firsthand. They know that to tackle a problem as complex as public health, you need a good plan, a blueprint for change, and that's where policy comes in. We're talking about policies that fight poverty, because let's face it, poverty is a major health hazard. We're talking about policies that ensure everyone has a decent roof over their heads, because cramped, unsanitary living conditions are breeding grounds for disease. And of course, we can't forget about education. Education is key, my friends. When people are armed with knowledge, they make informed choices. They understand the importance of hygiene, of vaccinations, of seeking medical help when they need it. It's about empowering communities to take control of their own health destinies. So, local authorities, they're the ones who can push for these changes, who can advocate for policies that create an environment where good health can thrive. It's about setting the stage for a healthier future, one policy at a time. Economic empowerment, investing in health. We all know the saying, health is wealth, right? But what about the other way around? Can wealth, or rather economic empowerment, be the key to better health? Well, here's the thing. When people have access to decent jobs, when they can put food on the table and provide for their families, it reduces stress. And we all know stress is a silent killer, right? It's about creating a virtuous cycle. When people have economic opportunities, they are more likely to invest in their health and the health of their families. They can afford nutritious food, they can access healthcare when they need it. Think about it. If you're constantly worried about where your next meal is coming from, are you really going to prioritize going for a checkup? Probably not. Local authorities, they have the power to create these opportunities, to support local businesses, to invest in skills training programs. It's not just about handouts, it's about giving people the tools they need to lift themselves up, to break the cycle of poverty and create a healthier future for themselves and their families. Knowledge is power, education and health literacy. They say knowledge is power, and nowhere is that truer than in the realm of public health. You see, when people understand how their bodies work, when they can separate fact from fiction, they make better choices. They're less likely to fall prey to misinformation, to harmful traditional practices, to quack cures. They become active participants in their own health journey, and that, my friends, is a game changer. Now, this is where local authorities come in. They can invest in public education campaigns. They can make sure schools are teaching kids about health from a young age. And it's not just about textbooks and lectures, it's about making it engaging, making it relevant to people's lives. Think radio jingles, community theatre, even using social media to spread the word. It's about meeting people where they are and giving them the information they need in a way that resonates. Because ultimately, an informed community is a healthier community. It's about empowering people to make the best choices for themselves, their families, and their communities. Chapter 4, Community Engagement, Building Trust, Building Health. You know, there's a saying, it takes a village to raise a child. Well, I'd argue it also takes a community to build a healthy society. You see, top-down approaches, they only go so far. To create lasting change, you need buy-in from the ground up. You need people to feel like they're part of the solution, not just the problem. And that's where community engagement comes in. Local authorities, they're in a unique position to bridge the gap between the government and the governed. They can set up community forums, town hall meetings, create advisory boards where residents have a seat at the table. It's about listening to people's concerns, understanding their needs, and incorporating their feedback into health interventions. Because when people feel heard, when they feel like their voices matter, they're more likely to trust the process, to support the initiatives, and to become agents of change within their own communities. Chapter 5. Building a healthier foundation, infrastructure and social services. Now let's talk about the foundation of a healthy society. And no, I'm not talking about kale smoothies and yoga retreats, although those are great too. I'm talking about the basic building blocks, the infrastructure and social services that are essential for good health. We're talking about things like access to clean water and sanitation. You see, when people have access to clean water, it reduces the spread of diseases. It means kids aren't constantly getting sick, missing school and falling behind. It means communities can thrive. And let's not forget about transportation. When people can access healthcare easily, when they're not stranded miles away from a clinic or a hospital, it can be the difference between life and death, especially in emergency situations. And then there are things like safe public spaces, parks where kids can play, community centres where people can gather. These spaces promote physical and mental well-being. They foster a sense of community, and they contribute to a healthier society overall. Chapter 6. Leveling the playing field, reducing social inequalities. Let's face it, life isn't always fair. Some people are dealt a better hand than others, and those inequalities, they often translate into health disparities. We're talking about things like poverty, discrimination, lack of access to education and healthcare. These factors create barriers to good health, and they disproportionately affect marginalized communities. But here's the good news. Local authorities, they have the power to level the playing field, to create a more equitable society where everyone has the opportunity to thrive. We're talking about targeted programs, things like food assistance programs for families struggling to put food on the table, health subsidies to make healthcare more affordable, and initiatives that address the specific needs of vulnerable populations. It's about recognizing that healthcare isn't one size fits all. It's about tailoring solutions to meet the unique challenges faced by different communities. Because ultimately, a healthy society is one where everyone has the chance to live a long, healthy, and fulfilling life. Outro, a healthier future for Africa. So, there you have it. By focusing on these strategies, by addressing the social determinants of health, local authorities in Africa can foster systemic change that supports long-term health improvements and reduces social and economic disparities. It's about recognizing that health is not just the absence of disease, it's about creating an environment where people can thrive, where they have the opportunity to reach their full potential. This holistic approach not only improves public health, but also strengthens the fabric of society by creating more resilient and equitable communities. Thank you for watching, and let's work together to make a difference.